Wallet! To begin, let us acknowledge that Queens is situated on traditional Anishinaabe and Haudenosaunee territory. We are grateful to be able to live, learn, and play on these lands.
Hello everyone, welcome to episode 6 of the Medicratic Podcast. Today we're going to be discussing truth and deception in healthcare, whether lying is justified in clinical practice or if withholding information is justified as well. So we're going to delve into this topic and try to figure out whether the truth is always necessary or if lying is ethical in some situations. So does anyone have any ideas that they want to get us started off with?
Whether or not lying in certain situations in terms of age of fiction comes into effect. So this can include the difference between hiding the truth from a child and talking to their parents, or in the contrary, discussing with older patients whether that would allow for lying or not, whether that's ethical or not, and what situations that may occur in.
I think that delves into just consent in general, right? Like if you're a child, you can't consent to most medical practices, so it has to be your parents who get the information. So in that case, it's kind of assumed that they're not getting it directly from the doctor. It's going to the parents first.
That's true. I think that it's more, I guess, on the parents if they want to be completely honest.
I mean, we can go over a case that this is from Doing Right, which I'm sure some people have heard of. It's just a guide, a book on ethical practices, and this is just a case from chapter 4, which is also about truth and deception. So it's a bit of a complicated case, but it's kind of important to go through. So it starts with a married 72-year-old retired construction worker. His name is Mr. G, and he has a history of severe coronary artery disease and type 2 diabetes and recurrent depression. So he's perpetually in a gloomy state of mind. He worries considerably about his health, and he fears that he won't make it past 74, the age his father and his father's father died of CAD. One day, his family doctor receives a letter from the local hospital informing him that he may have prostate cancer, he may have had his prostate biopsy done last year with an improperly sterilized reusable instrument, a patient on whom it had been used just prior to Mr. G, who later died of Creutzfeldt-Jakob disease, or the pronoun disorder CJD. So the doctor wonders what, if anything, to say to Mr. G. She had read of CJD being transmitted by neurosurgical instruments, but by a prostate biopsy device, the quote-unquote, the risk must be incredibly low, she thought. So she has no evidence for this disorder in this patient. She also recalls Mr. G reacting almost hysterically when she asked him several years ago about testing for HIV, which he responded with, "What is this? You want me to give another illness to worry about? I'm sick enough already." It took her about an hour to calm him down, but eventually Mr. G did the test, which was negative. She reads in the notes from his last full physical that Mr. G complained of impotence and was not having intercourse with his wife. So the doctor decides, on the grounds of compassion, to not tell him about the possible exposure to CJD. So do you think the doctor's decision was correct ethically? Let's not go into the laws quite yet. We can go into that later, but ethically.
Like, when I'm looking at it, I don't think that's ethical, and I do have two reasons for it. The first one is that it's not doctor's decision whether how you're supposed to react with this situation. It's a serious health condition. The patient should be aware they are having the condition because, or at least allow them more time to get prepared for the future treatment or any other procedure that they need to go through. It's not a matter of telling to the patient. I think it's a matter of how you want to tell the patient. Based on the case, apparently he has multiple conditions. He's not really mentally stable, so you can add another disease to his profile. So I think it has to be very gradually, or even can be delayed to make sure it's 100% confirmed. And then you can slowly explain that to patient. I think that would be the most ethical way to deal with this situation.
Now, what I would say in that case, what treatment is there for Creutzfeldt-Jakob? I thought that there isn't very many treatments.
So there is treatment, but there is no cure. So you can delay the symptoms.
What's the usual time of death when you have Creutzfeldt-Jakob?
It's usually fairly fast because it's very quickly neurodegenerative, I'm pretty sure. So that also
That's a big factor.
That's a big factor you have to consider, because the patient believes that he's going to be dead within 2 years from what he said, because his father and his father's father died of CAD. So
I think that's even more reason why you should tell the patient, because if there's no treatment and the chance of he being deceased is high and he may not have much to live, I think the most ethical way is to let him know, or if you cannot let him know, let his relatives, I do not know, spouse, children, grandchildren, or someone who takes care of him, so they would plan the rest of his remaining days to be as peaceful, as comfortable as possible. I think the patient has absolute right to know that how much time he have left, so he can plan accordingly.
So that's a good point. I think it's also important to mention that Creutzfeldt-Jakob disease is not just transmitted through neurosurgical devices, but it can also be transmitted person to person, maybe sexually. And he does have a wife. So if the doctor doesn't say anything to the patient, there's a chance that you're putting a third party in danger as well. At that point, there's laws about that. That's even more grounds for the doctor to tell the patient about the disease.
Absolutely, and I think there's only one situation that I can think you might. It's not withholding information; is that you delay when you're gonna tell them the information. I think that's acceptable under situations, and that can be because when you're not certain about the situation. So you have, let's say, you're seeing a combination of symptoms that indicate this specific disease, HIV, right? You haven't done a test, you haven't confirmed it yet. I would say it's very ethical to not tell patient some of your symptoms indicate you might have like HIV. I think that's a very wrong time to inform the patient. I think you should have concrete evidence about like your diagnosis. Say, I think it's this because of this image, blood test, or whatever is that, and then that would be a good time to tell.
You also probably have to consider the progression of the disease, because when you're thinking about HIV, even though that's slowly progressing over time, I think there is a period right after infection where it is reversible. Now, I don't know about Creutzfeldt-Jakob disease, but as a prion disorder, it's probably very quickly neurodegenerative, so it's probably best as soon as possible to get the patient on this treatment. Obviously, the doctor should do more research, because it's, I believe one of the quotes it said here, from prostate biopsy, the risk must be incredibly low, as she said, but she should find out definitively whether it's possible for it to be transferred.
Well, I think in that case, it's not telling them you have this disease, it's we need to get a test for you.
Yeah.
Right? And it's the same thing with HIV. You're not saying they have it, but you're like, to see if you do have it, you got to take the test. You know?
I agree. Like that would be a best situation. You're not telling them, I think you have HIV. You can say that there are some symptoms that may suggest that there's something going on. That's why we're gonna do this test to confirm. It's not definitive yet. But on his situation, not specifically for the prion disease, which is super rare, but for other situations where the patient is sensitive, anxious, or like he has too many prior bad experiences, they cannot take it no more. I think you can delay giving him information, just because that if it's not confirmed yet.
So it's very important to figure out a proper way to tell the patient, especially when they acted, as they said, hysterically before, almost hysterically before. But one more thing is, what about like not telling the whole truth? So what if you kind of purposely disclose certain parts of the truth in terms of compassion, but you still give them enough information? Is that ethical? You're not telling them everything.
I think that you should still provide the entirety of the truth, because there's a chance that they figure out the remaining pieces on their own and could become angry with you as the physician for withholding that from them. It just leads to more roots of, uncertainty or not good feelings for the patient in that situation. Regarding the delivery of the truth to the patient, I think that if you are knowing that this patient naturally receives information quite poorly, perhaps when you are planning on revealing this information after you have confirmed it, ask that his wife come along with him, or other family member that could help them take the news or the information a little bit better, maybe give them solace to a degree, and obviously fully explain the situation that it is rare, and in doing so, whoever comes along with them, if you can get them to join them, accompany them, can hopefully have a clear mind and support them in understanding.
In that case of not telling the whole truth, what are you not telling them?
I could see that you may want to exclude the severity of the condition. Say that
You may have
A to Z
test for it first before you say this is like one of the most horrible prion neurodegenerative disorders, right?
Yeah.
You don't want to say that information directly, because obviously if the patient doesn't have that, you're putting them through stress that maybe isn't required.
Would you usually say that before you give a test?
To what? Tell them about the severity of the disorder?
Yeah, isn't that usually happening after diagnoses?
That might be after diagnosis. So I'm not sure about that, but should you say it before?
Yeah, I get what you mean.
In this case, maybe, but there are other cases that it's actually, like, it just reminds me, because it's a personal case, somebody in my family, that they were about to develop Bell's palsy, and some of their nerves, especially I think the maxilla and the mandible, it was already kind of like senseless. It was gone. So she only had like a little bit chance to just go completely paralyzed in half of her face. So she goes to a doctor because something's odd, and the doctor, and he was a dentist actually, it was pretty funny, like he's sticking something in the mouth, and she's not sensing it. The doctor knew what's going on. He was pretty competent doctor. He didn't say you have Bell palsy, and if you don't get I think steroid was the first line, steroids, you're gonna go completely paralyzed in the face. And we have to know that Bell's palsy is very sensitive to cortisol. And if you say that to a person, especially if they're anxious, because that specific person was, what's gonna happen, you say? They're gonna be extremely stressed in that situation. It's probably gonna make the disease much more progressive and reduce the chance of effective treatment. In that case, what the doctor is that he said, "Oh, it's fine. It's not serious. But I would say we should get this treatment right now to just make it stop to progress." That's not telling all the truth. He's kind of right. It was that it can be managed. It can be stopped by a single shot today. And when he did that, and when they repeated the procedure for like I think 2 weeks, and then it starts going backwards, starts healing, and she was sensing it, and then he talked to her what was going on. So at the end of the day, he did not withhold, and he just delayed when presenting the information, because it could negatively influence patient's condition at that moment. So the conclusion is that you don't get to withhold information. You only get to when you're gonna present the information. So and not telling all of it. I think you only need to tell the details that are relevant to your decision and the patient's situation. Anything outside of that that's not relevant, the patient doesn't need to know, because it doesn't affect them. Just giving you more info, you're not gonna help them. Just gonna make them more confused, and you're just gonna waste time on something that doesn't gonna go anywhere.
So, what I'm wondering then, is there any occasion where not telling them is acceptable? And I'm specifically thinking, if you think of DNA tests, there are some mutations that can increase your risk of certain disorders, including cancer, but we have no way to treat them or even offer palliative care. So the question is then, do you tell them that they have that? Because that can actually affect insurance, that can affect all these other things, and obviously make them anxious as well. Or do you just leave it? Because at the end of the day, there will be no clinical benefit of them knowing it.
So I would still say yes. And this one I can tell it from personal experience, because I got screened for a G, and I do have a mutation in one of my genes, because my father had, and it's kind of. It doesn't feel good when you have I would call it a silent bomb in all of your cells. It can activate at any time, and you cannot know about it. But knowing that you have this bomb is actually pretty helpful, and this is why you should not be told the information from the person, because then you can change some habits to decrease the chance of developing that cancer. In a sense, you're compensating for not developing that cancer. So let's say you don't have the gene, but you engage in some certain behaviors that increase your chance, right? I do have the mutation, but if I know I have the mutation, and because of that, like fear, I would not engage in those behaviors. Let's say I wouldn't expose myself to a harsh sunlight. I wouldn't go like probably over some like cigarettes or like too many alcohols. So I would avoid some behaviors, and I think that would benefit me in the long term. And most people with those mutations, if they just change the habits, very unlikely they're gonna have the behavior. And honestly, changing the behaviors is gonna benefit all aspects of their lives.
So that brings up the same point from before, how you're not just affecting the patient, you might be affecting the patient's relatives, right?
Mm-hmm.
So in your case, you can modify your lifestyle to try to change those effects because you learn that.
Mm-hmm.
Just one more add point, and that's something that my father oncologist was really helpful, because when they screened for my father for that mutation, it came positive. He didn't withhold the information. He said that, Mr. Shirazi, this can be, not always, there's a chance that it can be inherited. And it's usually goes through autosomal dominant. It's very likely your son might carry it, like copy. So that's why they suggested to me, maybe you should get screened to see if it's there as well. So him not withholding information that it is hereditary influenced my chance of developing a condition. So I think at the end of the day, you should not withhold it, because it's not just, as Stefan said, it's not positive, just benefiting the person. It can benefit his or her family.
Mm-hmm.
That's also just as like a random side point, that's the difficulties of being a genetic counselor as well. That's why there's a whole profession dedicated to that, because it's such a complicated topic.
I think they do have to pass courses in terms of like human psychology, or like how you're gonna interact with patients.
Anyone have? This can be a relatively short episode where we just kind of went over a case, unless anyone wants to talk about some more specifics. There's a few laws surrounding it, but we basically went over them because they're fairly ethical. There was a few cases in the 80s and 90s that were about malpractice, whether you should tell. So I guess another one that's just quickly to, like, if we want to finish it up, is not exactly related, but kind of related to truth and deception. When you have confidentiality as a physician, or generally like a psychiatrist, a counselor, and your patient tells you that they're going to do something to harm others, you break confidentiality, or do you keep the confidentiality? And there's a law that says that you have to. But
yeah. I'm not sure about the details of it. I think the law is specific to few things. I think it's murder. I think they should be like same level as that. It's like federal crime, like something like hardcore crime. But if you say that, no, I have these intrusive thoughts that I'm thinking I'm gonna harm someone, I don't think they have a right to break confidentiality. I cannot say the word properly.
So the law creates a line. Now let's say that as a psychiatrist, someone says they're going to do something and they're intent on doing it, but it doesn't reach that threshold where legally you can say it's not murder, but it's something less serious than murder, but will still harm another individual. I'm
pretty sure a psychologist is trained enough to pick up on many other like signs of a person might be, I do not know, maybe mentally disturbed with antisocial person like characteristics, that he has tendencies, like actual tendencies that allows him to do so.
Mm-hmm.
I think at that point he should make a decision. Okay, that might be a little bit serious, and then I think I can understand that. But for many people, especially for like teenagers or adolescents, just having the thought, or like you thought about it before, but you're not going to do it. Like I think that's one of the questions psychiatrists ask you. I was like, are you going to do it? If they say yes, I would take that case a little bit seriously. But when they say no, I just have the thought, no, I don't think you can break confidentiality.
Confidential.
That one.
That's from the Canadian Code of Ethics as well. The exact wording of what they say is, when counselors become aware of their client's intent or potential to place others in clear or imminent danger, they use reasonable care to give threatened persons such warnings as are essential to avert foreseeable dangers.
That's very reasonable.
It's a reasonable, yeah.
I was gonna say that if an individual was to make such ideas or show such intent or tendencies, that reaching out to relatives to not necessarily break confidentiality, but to inform them that they may want to spend some time with the individual and
If
help them
possible.
through a hard time, if that is possible, to do so. Again, surfing on that line between breaking confidentiality and reaching out to those that can support the individual.
Yeah, there's a lot of, I think the moral of the story is there's a lot of steps you can take without going directly into the judicial route. So, talking to families, trying to reason with the patient that the counselor is talking with. But the whole purpose of like these ethics questions are not to talk about the extreme cases, like murder in that situation, or the extremely easy cases, but trying to go around that line when you're saying, oh, this is kind of going over the line. It's not really good enough to say, hey, this is breaking the law, right? But it might put other people in danger. So
I agree.
that's basically the gist of everything we've talked about until now. If anyone has any other ideas,
I think we can conclude that you should not be told the information, as it's not ethical, because it may put the life of patient and their relatives in an unnecessary risk. And at the end of the day, a physician or like a caretaker, it's not our responsibility to decide how a patient's going to deal with their situation. Our only purpose is to deliver the information in a most sensible manner to the patient, give them the options that is currently available, let them decide over their health and their life and like their families. I think as simple as that.
It builds on the concept of autonomy, right?
Exactly.
The patient should have choice over their life unless psychologically deep unfit.
Exactly, and this is one of the core principles of like modern medicine.
Yeah.
autonomy.
Exactly.
So we talked about the case. We talked about when to delay information, you shouldn't withhold information, different ways to deliver information, and then we finished with some laws and specifically about counselors and their right to break confidentiality and tell the truth. So thank you for listening to, I believe this is episode 6 of the podcast, and we're excited for the next episode.
Have a good one, everyone.
Thank you.